Because it stands for Lung Cancer Awareness, and it is Lung Cancer Awareness Month. Early detection is critical because 142,000 people in the United States die every year from lung cancer-related illnesses. Dr. Benjamin Northrup is a radiologist from North Kansas City Hospital, and you're here to talk about screening. So this is a devastating, 142,000 people die each year from lung-related illnesses. What's going on?
Yes, the rate is very high, and unfortunately in Missouri it's even a little bit higher, 14% greater than the national average. That's fifth in the nation. Luckily, mirroring the national average, 22% of these cases are found at earlier stages, stage 1 and stage 2, when the disease is more treatable.
Okay, is it smoking? I know we have the new vaping thing now that's affecting and causing many lung diseases, but is it smoking? Is that the #1 reason?
Yes, and vaping is certainly a concern, but the #1 cause is still smoking. The high rate of smoking in the United States has led to these unfortunate numbers.
What are the symptoms and signs? Do people have these lung disorders and don't know it? They just think it's a cough, it's a cold?
Yeah, and that is one of the scary things. There certainly are symptoms, and if you are having symptoms such as a cough or coughing up blood, things of that type, it is important to go to your doctor. But more importantly, if you qualify for screening, getting screening is the best way to avoid it, because most people have no idea they have the disease until it is almost too late.
All right, so what do we do for screening? Just, is it during our normal physical exam that we go in for every year, or is it specific and special?
Yeah, and the physical exam is definitely an important part of anybody's yearly checkup, but this is a little bit different. So CT lung cancer screening, specifically low-dose CT lung cancer screening, is the new tool we have, the mammogram for the lungs, so to speak, that will help us detect lung cancer early. This is something that's pretty new. It helps us see even the smallest lung nodules, as small as just a couple millimeters, and it uses a very low dose technique, which means low radiation. So that saves you from higher doses of radiation that can cause more problems down the line.
Is this something where we need a doctor's referral, or can we just go in and get a CT? Can we schedule that as something we can just personally do, just call and schedule it, or?
Yes, it's always best to go see your doctor first and talk it over to make sure you qualify. Just for the information of our viewers, how you qualify is if you're age 55 and older and have greater than a 30 pack year smoking history. Now, what a pack year is the number of packs that someone smokes per day multiplied by the number of years they have smoked that number of packs. So, for example, if you smoke 2 packs per day for 5 years, that would be 10 pack years.
My goodness. All right, so what can you do? You find a nodule, it's early stage. You said it's treatable, curable.
Yeah, and that's the key. When we find it at a lower stage, stage 1 or stage 2, we can, well, first off, if we see a nodule, we can follow it. If it's one that looks not too suspicious or just borderline, we can just keep watching it yearly and make sure that things are not getting worse, make sure that it's not a risk. And then, yes, if it is something that ends up being cancer, meaning the patient would go on to a biopsy and referral to a surgeon, then the next case would be to get it out of there via surgery and make sure that it doesn't hurt you anymore, that it's gone.
So surgery is kind of the cure, the way to...
Surgery is usually what it leads to if you do find a growth that's a cancer, yes.
So last bit of advice for the viewers here today. What would you say to them regarding, their own lung health and the health of their, relatives and friends?
Yeah, so if it's something that, if you're a smoker or if you have a known history of lung cancer, it's very important to speak with your doctor and determine if this is something that you qualify for, and if so, it's a very safe, simple, and easy procedure.
All right. Thank you, Dr. Northrup, for coming and for sharing. And we appreciate it. We'll be right back.
Yep.